Do we want to talk about money? That's always kind of the...
Let's have that uncomfortable conversation. Frankly, I let the office manager, the implant advocate manage most of those discussions because there is more that plays into that piece as far as, do you have dental insurance? What kind of options do you have to cover the cost? But let's dive in.
Yeah. And I think this is another one where, that's probably the second most common call we get is, well, can't you tell me over the phone what this is going to cost?
Right.
And again, that's the, well, it depends answer.
Sure.
Right. So, but ballpark wise, dental implants are not inexpensive. They in fact are expensive, right?
That's right. And part of that is to get the equipment in there, you work with labs, you work with implant companies. There's a whole kind of team behind the scenes that play into getting this done right.
Well, and I think the general populace knows that, unfortunately healthcare is just getting more and more expensive, and there's a lot of driving factors for that. But that's one area where I think that we really do shine, back to our background in the digital workflows.
Sure.
By reducing our chair time, our in-office time for each patient, it's mutually beneficial, right?
Absolutely.
If we're paying less staff, spending less time going through all those extra appointments we used to do,
right?
We've been able to lower our fees and
pass
that
those
on to the patient. But yeah, I mean, the cost for a single implant varies, and ballpark nationwide is probably somewhere between $5,000 and $8,000.
Sure, that's about right.
And then full mouth, usually, full mouth implants is usually by the arch. And I think there are a lot of nuances and important questions to ask around that. Some people will advertise a really low price, say as low as this, and then you dig into it and it's like, oh, well, that's actually just for the surgery. Or they only do, the traditional model where they split the surgery is done by a specialist, and they only restore in the office, and they're only talking about half of it. Over the years, a lot of patients have gotten caught in that where, I remember a poor patient that I saw a few years ago that came in and said, we went over everything, and she said, well, I really like you, but it's actually this other guy can do it for less. And I said, oh, really? Okay, that's great. Usually we're a good value, but you do whatever you feel good about.
Of course.
Just happy to be here for whatever you need.
Right.
And she ended up going and getting it done. And then I saw her back in 4 months and just extremely upset.
Oh, of course.
And then she just had not realized that, like we talked about before, the implant has 3 parts: the actual implant fixture, the abutment, and the crown. So she had quoted, we always quote the bundle, right? Start to finish. And she had been quoted just 1/3 of the process. So, and then she ended up paying, she had us finish at that point, but she ended up paying substantially more than she needed to.
Yeah, it's a shame. And you see that a lot. There's billboards, there's things you'll see online where they come across and it's kind of a hook and bait kind of thing, but it's really I don't like that. So my philosophy is like, hey, here's everything. Here's the full bundle. Here's the cost, start to finish, because that's what I would want.
Yeah.
I don't want to be tricked into a higher cost later. I think that's a good way to upset people.
Yeah. It very much feels like a bait and switch, and that's, I think, why we've tried to stay away from that. But yeah, there is a lot of cost disparity. I've seen, we see arches in our area up to $40,000 an arch. Mm-hmm. We see things advertised for as low as $15,000 an arch. But, every time I've dug into that, that's kind of a little bit of that bait and switch model.
A lot of it. Well, it depends on the final restoration too, whether it's softer printed material, if it's a nice zirconia that's smooth like enamel and it will hold up to all the things you want to eat, or if it's gonna fracture on you. So you really need, want to get something that's gonna handle an occlusal load, a chewing force on there.
Yeah, well, and again, the evolution for us, right, has really evolved to zirconia final restorations.
Oh yeah.
Just because we've, it's back to what would you want for your own mother?
Exactly.
Right. And there's no perfect material, but zirconia is far and away, it's very biocompatible, very, very compatible with tissue long term. It's a very strong material.
Very strong.
It's aesthetic. It's pretty. It's really got, when you look at all the things that we want, it's the only disadvantage is its expense. really when it comes down to it.
That's it. Well, and the good thing is when you come in and have that conversation with us at the office or at any office, there should be some options on how to pay for this, especially if it's a full mouth restoration. And that's where that conversation should happen at that first visit, where you say, okay, here's the best here's the plan for you. Here's the best treatment plan, and here's a way to get there.
Right.
And I think that's, I've heard people feel lost. We're like, okay, there's that, but I'm here. And that's where the conversation happens. Hey, here's a couple options. Here's ways people can get this taken care of without feeling like you're in a used car sales lot, which is feedback we've heard from some of the bigger corporate outfits.
Yeah. Well, and, back to the car analogy, I think a few years ago, that's what we were bumping up against, right? We had a lot of patients that could afford to get into the overdenture territory, but not necessarily to the best option. And we looked at ourselves and like, have you ever gone to a car lot and just bought a car outright? I mean, that doesn't really happen.
Not really.
Right? It's that industry's figured it out. And what we offer is kind of in that same price point.
Right.
With the difference being it's an investment in your health versus something you'll trade in a few years.
Yep.
But regardless, there should be similar options. So I think we've, for the last 5 years at least, we've really tried to make those options available where, working with financing companies, looking at alternative financing options.
Exactly.
But, again, we know this is expensive, but we can make it affordable to most people.
Exactly. And they can get it done. I've had school teachers come in, people who've been janitorial. We've had people who are retired on fixed incomes, people in all types of scenarios. It doesn't matter of their life circumstance. If they have a desire to get this done, the office, the team, we want to see that happen as well because we know the benefits. We know how it can affect someone's life, and we want to remove those barriers of costs and things like that so it can happen. And so by these financing options with good interest rates, our relationships with those third parties, it makes a big difference for people.
Yeah, it does. And I think, like you said, it's the partners in the industry, right? We worked with a lot of these guys for a long time. They know what we do is legitimate.
Right.
They know that we are being responsible on our side. So they're willing to lend kind of based on that reputation.
Exactly.
And, another thing you said that it was interesting that I want to touch on a little is it really, I think, depends more on the desire of the person. I look at some of my favorite patients, or I have several patients that are waitresses.
Right.
But they just really, they value
right?
it.
Exactly.
We also have people come in that could write a check, pay for it in cash, and they don't value it. They say, I don't know, I might die soon. I want to leave money to my kids. And I think, again, that's, for us, we're not here to judge people. We're here these are your options. You have your own value system, and we're not
100%.
We're not here to tell you what's right or wrong with that. If you want to go buy a nice truck instead, great. If you want to invest in your teeth, that's what we're here for. But yeah, we're not, like you said, we're not going to do the hard sales pitch. It's just come in, let us show you your options. We're here if you want us to help you out. That's kind of the mentality I have around it. And I think we're blessed in that we have a lot of volume. We've got busy practices, so we're really not trying to talk anybody into it that doesn't want it.
Exactly.
Ultimately, that becomes a problem for us, right?
Well, of course.
Talk somebody into it, and then it becomes our problem. Whereas I want that patient to own that decision.
Yep.
It's something they're excited about and doing, and we'll be right there along with them every step of the way to get them there. But I want them to own that decision.
I 100% agree.